Dr. Ruffner, let's talk about you coming in as TMA President. Would you mind giving me some background on your medical career?
Sure. I don't talk like I'm from East Tennessee, but I am. I was born in Rockwood, Tennessee. Then during the war, my family went to Washington, D.C., so I pretty much grew up there. Went to public school in Washington. Did spend some time overseas. My father was with the State Department. Then went to Duke Med School, and was really pretty much on my way to a career in academic medicine. Was interested in research, enjoyed chemistry, and I actually started doing research when I was in college. So after finishing up my residency at Duke, I went to the National Cancer Institute, where I stayed for 4 years, including 2 years that I worked with a Nobel Prize winner, which was really quite an experience. After that, I came back to the University of Virginia. My wife's from Virginia, so for some reason we ended up at the University of Virginia, and taught there for 6 years. And it really was a struggle to do what I thought was a good job of teaching, taking care of sick folks, and also trying to run a research lab. And after 6 years of that, I realized that really where my heart was primarily in taking care of patients and secondarily in teaching. So I started looking around, and in 1976 there was no medical oncologist in Southeast Tennessee, and Erlanger Hospital was a very impressive hospital. It was really a surprise to somebody who had been in academic medicine all their life to discover that in many ways that hospital was more sophisticated than the University of Virginia. So it was an easy transition for me to become the first medical oncologist in Chattanooga, North Georgia, or even Western North Carolina. So I went there in '76, taught, but mainly took care of patients, and really had a very happy 34 years there.
Great. And what have you done most recently with them? I know you were...
Well, really my career almost sort of evolved back toward academic medicine about 10 years ago when they needed a new chairman of the Department of Medicine. And even though I was an unpaid volunteer faculty member, they came to me and asked me if I would be willing to become interim chairman of the Department of Medicine, which meant I had to teach not just medical oncology but also cardiology. And of course I wasn't very good at that, but I was good at teaching them about patient care and how to do a good history and physical. So at that point I was about half-time clinical medicine and about half-time academic medicine. And then in the last couple of years I evolved over to being the interim dean. So I was not just in charge of medical residents, but also surgery, plastic surgery, etc.
Okay. At what point did you get involved in organized medicine?
That's a good question. And I would say that pretty much evolved when I was interim chairman of the Department of Medicine. I had always taken care of indigent patients, but when I became chairman of the department, I started thinking about such things as how much were we getting paid for TennCare, things of that sort. So that really forced me to start paying more attention to the business side of all medicine, and that really led me very quickly to the TMA. I was actually a member of our board in Chattanooga back in the late '70s, but didn't really put my heart into it at that point. So there was a long period of time there when I was just busy teaching and taking care of sick folks.
Okay, and this weekend you'll be installed as our new president. Tell me when you decided that you might do some good there.
I think probably when I stepped down from being interim dean and was looking for a new mountain to climb, and was honored, obviously, to be elected, and look forward to serving. And I think after 1 year as the president-elect, I have a tremendous amount of respect for those presidents that do it while they're still trying to run practices. Because I would guess it's taking me 20 hours a week right now, and I anticipate as president it'll take me 40 hours a week. And I'm glad I have the time, and hope I have the talent to do a good job.
All right. What are your areas of priority going to be as the president of the TMA?
The two big things that I would like to focus on are, number one, the medical home. And I think it's timely for folks to know that I'm not a primary care physician, but as chairman of the Department of Medicine, and saw the residents coming through and how few of them were interested in primary care. They all want to know if I can get them a fellowship somewhere. That I recognized that the really bright kids are not going into primary care right now, and we need to change that. I have a tremendous respect for the ones that do, but I can also understand the struggle they have in order to do that in terms of long hours, short pay, and I'd like to do what I can to help change that. The other thing is electronic medical records. They're a headache until you learn how to use them, but I think once you do understand how to use them, they're going to make physicians' life easier, and also make it possible for the profession to more accurately gauge how good a job we're doing, which I think is going to be important.
The quality of our care.
That's right.
Of your care, right.
And as I'm going to say in my remarks in 2 days, if we don't measure ourselves, somebody else is going to measure us.
Very good. On eHealth, you are doing some other things. You're the chair of our eHealth task force here. You're also part of the HIP 10, which is the health Tell me what that is again, I'm sorry.
Well, it's an exchange. It's going to be an information exchange which will be statewide, which will make it possible for us to exchange x-ray reports all the way from Kingsport to Memphis, if the situation needs to be. Mm-hmm. If you have a new patient in your practice new child who got most of their vaccinations in Memphis, you'll be able to go to the exchange and tell immediately what they've already had. If you want to get a copy of an x-ray report from a patient, you'll be able to get that. And the state, and I also think this is important, it'll make it possible for us as a state to look at how good a job we're doing if women getting pap smears or getting their mammograms done. And those are obviously issues that a medical oncologist pays attention to. And it'll make it possible for us to measure ourselves and hopefully improve.
Okay. During your tenure, what would you like to see happen within the TMA and eHealth? Do you want to see the TMA become a resource, maybe, start providing some assistance? What are you thinking of? Maybe partnerships that we need to establish?
First, our eHealth work group is really very impressive. To me, it's an example of the TMA at its best, both with the staff support that we're getting and from the involvement of knowledgeable physicians. So we've got a good group to try to accomplish some things. So what do we want to accomplish? I think we want, number one, first and foremost, we want to encourage physicians to get electronic health records and draw down the $46,000 that's out there for each one of them. $46,000 is probably not going to be enough for everything, but it's certainly going to be a helpful incentive in terms of getting that done.
All right. Let's pause it. Wait.
Okay.